And hello to you. If you're new, welcome. If you've been here for a while, then you know what's going to happen. Let me get off the main screen here. Today, the format of the show is typical. So we're going to go all the way to the next hour. And you guys are muted, so you won't be able to, but you can put things in the chat. And then some of us will be going through the chat, seeing if there's any specific things we need to address. Otherwise, we'll keep plowing through. And then after this first hour is done, which by the way, there'll be wings credit for, you'll see that in the chat. So there'll be a link in the chat that you must click to get wings credit for. There's no other way to get it. So you click there, click there, put in your email and that stuff, and put your name. That way, if you screw up, it's on you. And then we'll upload that all to the FAA later today or tomorrow, and then your credit will come out of. That's how it goes. But you don't see that link for a little bit. And other things that we might want to put in the chat, we might have some things from us. Anybody has, you can feel free to put in there. Like if you have a particular thing, just write up in chat what you want. That's basically the idea of it. Okay, so that's what I wanted to say is the intro. And then the second hour, there'll be more hours, but you don't have to be around for those for wings credit, or no one has to stick around for those. You know that we do second hour will be open mic. I will go off in the breakout room and you guys can talk amongst yourselves and ask questions. If there's someone around to answer them, bring up any topic you'd like. And we keep the room open until there's no one left. And so usually we have a couple hundred people who will stay around for the second hour. That's kind of the way it goes. Okay. So then we have about 362 in the room. So we're likely to have 400 and something here pretty soon. So that's usually probably where we'll be. So just so you know. The last thing I wanted to say was something about well, we talked about Mosaic already, so we're going to talk about that later on. That's another 3 or 4 weeks, about 6 weeks, no, 2 months and a half before implementation. So we'll talk about that and how that might affect all this. In the meantime, I wanted to introduce Bill. So he's an AME from Prescott. Hello, and he's got a slide shit deck for you all ready to queued up. You can queue it up now if you want, and then we can make sure it all works and do all that. Then he'll talk about himself, and he does a lot of exams for kids from or people from Embry-Riddle there because it's a big campus. So I'm gonna have him take the helm and say what you'd like to say. Welcome, and by the way, thanks for coming. We've never had an AME on, so it's really good for us to hear all this.
Well, well, great. Well, hi all. Yeah, I'm an AME. I've been AME now for uh, about 12 years, and I'm a senior AME, and I do see a lot of folks uh, and certify them. I'm a pilot. Let's see if I can get the screen to advance. Hmm. Yeah. Oh, yeah, yeah. Okay. So, I'm a pilot. I'm also I'm a senior AME. That means I can also do class one medicals in addition to class two and three. Um, I'm a pilot. I have a commercial rating. I'm a CFI for gliders, and so I do teach glider with the Prescott area soaring here. And in addition to my regular practice. When I decided to be an AME, I'd been flying for a while and I thought, well, I ought to participate. And so I applied after doing some testing and things like that. Uh, FAA made CAME available, which is the Civilian Aviation Medical Institute, and went there for a week to learn about being an AME and training that. They spent most of the week teaching me how to do a physical exam that I've been doing for the past 40 years, and a little bit of it trying to show me how the program works and get in and be able to file stuff. And it's been kind of a learning process all along, trying to get things going. This last week, the FAA decided to change the way they log in, and now we have to go to the government. It took me a week to figure out how to log into the program again. So it seems like the technical parts are the hardest part. taking care of pilots and doing that stuff is really uh, not that difficult, and so that's a lot of fun. And I really try and help the pilots get through it. Some of the other things you can get at CAME in Oklahoma City is you can do these other courses, and I did some of them. In order to get into the reduced oxygen environment, you have to have a medical. Um, but it's interesting, and it's for all pilots. So anyone who wants to do it can apply and get in and do those things. They have some other special programs, obviously water recovery and survival. They have a wind tunnel with the carcass of a 172 in it, and you try and start a fire in the wind tunnel. Uh, so it's kind of fun. So some of the things that we studied uh, specifically to pilots, things that I don't see with my usual patients, uh, are these things. Uh, and we try and take into consideration some of the special things that pilots are faced with. Recently, what they've been doing is they've kind of focused on some of the psychological aspects of being a pilot, with the Air India crash and those kind of things, and screening for those. And the FAA is going back through and looking at some of their pilots that have PTSD and things like that on their record. And then they ask the pilot to explain some of those things, and they expect the AMEs to kind of look at those too. So we look at all aspects of flight. The AME is really kind of the link in between the pilot and the FAA. And I look at my job uh, as not only keeping the nation's airspace safe, but also helping the pilots keep flying. And there are a lot of things that can get in the way of that. And a lot of times with discussion with the pilots, I can help them keep flying and not get into trouble. Anyone, can go to faa.gov/go/AME, and that's the guide. Those are the protocols that I use to certify uh, the pilots. And you can look at those things, and there are things like pharmacology, the medicines you might do, or some of the uh, different conditions a pilot may have that might interfere. And it also shows the standards that we have that we use. I see a lot of student pilots, a lot from Embry-Riddle. And so very often I'm the first kind of interface with the FAA that a student pilot has. Uh, it used to be that the AME was the one to um, issue the student pilot certificate along with the medical certificate. And they ended up with both that certificate after seeing me. Now it's really you, the CFI, that is the person uh, that issues that, and you're really the interface in between the nation's airspace and the student pilot. Of course, we all fit in here. Now, what happens is rather than getting a student pilot certificate, the student pilot applies through you and gets a pilot certificate, and then they come to me and I give them their medical. It is important. We were kind of talking a little bit beforehand, and one of the important things is that everything be congruent. So their identification, either passport or driver's license, their pilot certificate, and their medical should all have the same identification, the same name. So if you have a middle name on your driver's license, you ought to have a middle name on your medical. Otherwise, you get a DPE out on the ramp and he says, "Who's this guy? I'm supposed to see John Paul, and this is just John." So make sure your students do that. Back in 2016, the system changed. Rather than the student filling out a paper certificate, they now go online to fill out the certificate. And of course, for students under 40, it's their medical certificate is good for 5 years. Over 40, it's 2 years maximum, depending on the class. And now the student pilot gets it through through either their CFI or the FSDO. Usually takes about 3 weeks, as you know, to get it. And the minimum for the pilot certificate is for power is 16. For gliders, you can solo a glider at 14. So go through IACRA, which you all know is just another headache. I always have trouble getting the student pilots through IACRA. And if they're international students, they can also do it another system in order to get in there. There are about 2,000 AMEs in the country, and kind of spread out through all the regions. We also have a couple of hundred AMEs in foreign countries that can help either non-citizen pilots get their medical certificate, or citizen pilots get their medical certificate overseas. Most of the AMEs are family doctors like I am. A big chunk are internal medicine doctors, general internal medicine. My associate in the office, also a senior AME, is a cardiologist. So his primary practice is cardiology, but he also does AME. Of course, they're aerospace and occupational medicine doctors, and that's kind of their gig. This is what they do. The number of pilots applying, some of my data is a little old, but that's the slide I could steal. So the number of private pilots has been decreasing, but you can see that commercial and ATP pilots are staying about constant. The way that you apply now is through MedExpress. And if you'll notice, the FAA decided to spell express differently. So just be sure that you know how to do that in order to get on and make that application. You make that application online, come with a confirmation number to your AME, and then the AME can pull up your application, make modifications to it, add that middle name if you need to, go over your medicines, maybe go over some of your medical history and add those things to your application to try and get it accurate. On the application, there are a whole list of things that the FAA asks for in terms of your medical history. And primarily that list is to prompt me to then ask questions about that and dive deeper into those things. One of the things that people often will put down is admission to the hospital, and say, "Oh, well, what was that admission?" They say, "Well, I went to the emergency room, 2 years ago when I had the flu, and I didn't spend the night and I went home." In my mind, that's not an admission. And so I'll try and get rid of that, because otherwise you'll have to explain that for every medical you get for the rest of your life. So we can kind of trim some of those things down and get those things a little more accurate. So those are just things that are important for the AME to know. By the way, one of the things that always comes up in that form is question 17B. And it says, do you ever use near vision contact lenses? And everyone says, yeah, I wear contact lenses and it's so I can see close up. And so they mark yes. And that's not what they mean. What they mean is some people will have a reading contact in one eye and a distance contact in the other eye. And that way they don't have to wear glasses to read, but it makes landing and getting that flare a little difficult. So the FAA doesn't like that. So that's really what they're asking. So it isn't just if you wear contact lenses, which are perfectly okay. It's if you wear those two different kind of contact lenses. That's where the problem comes up. Um, so if you fill out the form, or if a student fills out the form, and they decide not to get their medical, the form kind of sits there in the system for 60 days and then it just disappears. It goes away. And it's like it was never there. So if you made a mistake, if you aren't sure about something, you put something down that, talked about your prison time and mass murderer and that kind of thing, and you say, maybe I won't make this application. After 60 days, it goes away and no one sees it. Once I open the form, it belongs to the FAA. And I can't get rid of it. You can't get rid of it. And it's somewhere in a computer in Oklahoma City. And so very often I recommend if there's something questionable, it would be best to go in and talk to the AME and say, hey, I have this situation and this is what it is. And maybe ask for a free physical consult. Have a little office visit where you can sit down and talk about these things before you get your medical. And very often, the AME can then advise you on, oh yeah, if you're taking this drug, it isn't going to happen. You aren't going to get certified very easy, and maybe you need to um work with your doctor to change your drugs. I had a fellow from the Congo who was diabetic, and an AME sent him to me to get him on a different treatment for his diabetes that wouldn't interfere with his flying. And we worked for for about 6 months getting his diabetes controlled and something that wouldn't disqualify him. So talk to your AME. We're really there to try and help you get certified, not just keep you from flying. The FAA is very risk adverse, and rightfully so. They really want to have the safest aerospace in the world, and so they look at all the little nooks and crannies to try and be sure that there isn't something that is going to cause a problem. Really, our kind of our standard is what is going to cause sudden incapacitation. And it's not good that you fall asleep on short final. So we really that's kind of the goal of the FAA. And the FAA or the airspace system has done very well. The number of fatal accidents continues to decline. Uh, Exception the the thing we had at Reagan, but continue to decline and do a good job. And so that's really the goal. And even for general aviation, uh, the uh, the number of accidents, the number of fatal accidents continue to decline, and we continue to do better and better. Um, So over the hours flown, we continue to have a decrease in fatal accidents. There are some disqualifying conditions uh, for a medical, And if you have one of these conditions, it disqualifies the pilot from having a regular issuance. Um, and that means you go in, get your physical, uh, the AME issues you a medical certificate, and you go fly. If you have one of these things, that isn't going to happen that easily. That doesn't mean it can't happen. And there is a process called special issuance. And that's where if you have one of these conditions, through that guide that I mentioned earlier, there are um, some standards that if you meet those standards, you can then go ahead and get issued a special issuance. And sometimes it's time limited. And so rather than having that 2 years on your certificate, maybe they would only give you a year, sometimes 6 months. I've even heard sometimes in a special issuance, you'll have to go back and get a medical every 3 months in order to keep flying, but you can keep flying. The biggest problem, of course, comes when a pilot refuses to submit their medical records or the information to the FAA. And that's the number one reason why the FAA would deny a medical certificate. Um, what happens is if you have one of those conditions, you come in, I go through everything, and if everything else is okay, I will defer your medical to Oklahoma City. They will then, within 60 days, and they pretty much have committed that within 60 days, they will send you a letter back saying, well, because you have this condition, you don't qualify. But if you give us this medical information, and it might be something where your cardiac catheterization video is sent to them and they review it and look at where the stent was placed and all that kind of stuff. They say, okay, we will give you a special issuance, um, and you will then every year give us a stress test or whatever to get this certificate. And then they will allow you to fly under that special issuance. Sometimes you'll have to continue to respond to Oklahoma City. Sometimes they will say, every year we want you to go get a medical from an AME and bring this data to them. And that data will then allow that AME to uh, give give you a AME assisted special issuance, and you don't have to go through Oak City. And the AME can then take that data and upload it, and I can put that data directly in your file in Oklahoma City, so it doesn't get lost in the mail or anything. And that's really a much better way to put things in there. There's some things I can't do that with, but most things I can just put right in your file, and it doesn't have to go through the mail room in Oklahoma City and then have someone scan it and then have someone find your record and then put it in the right place and all that kind of thing. I can do that directly. There are some conditions that used to be a special issuance, and now those conditions are something called a CACI, or conditions AMEs can issue. And I can look at the guidelines on the site, and then if you bring me that information, I can then just go ahead uh, and issue with that. One of the common things is hypertension. And it used to be that hypertension was a special issuance. Well, now for a long time, we've had those uh, conditions where if you bring a note from your doctor saying, yeah, he's on this medicine, and I look at the medicine and it's not going to interfere with your flying at all, and your blood pressure is in good control, I can just go ahead and issue, and I can say, this pilot is CACI qualified for this condition. This is an old list. There's now, I think, 26 different conditions that I can issue with. And again, that's uh, in that guide for AMEs. One of the common things is obstructive sleep apnea. Uh, and that's a special issuance, but it's something that then ends up being an AME assisted special issuance. And if someone is in CPAP or having trouble with that, originally they need to submit stuff to Oklahoma City. I have to defer and they submit it. But then after that, I can go ahead and assist in that special issuance for you, and I can get you in the uh, get your certificate so you don't have problems with that. Uh, the Oklahoma City's a busy place. So back in 2020, they were processing 356,000 applications per year. Uh, and so they are trying to limit the amount of stuff that they do. And that's kind of why why the conditions that AMEs can issue, came up so they don't have to do it. They have been talking this last year about, rather than deferring, when I defer, they just send back a denial. And then that denial requires the pilot to appeal the denial. Then they send the letter to the pilot saying, okay, we'll consider a special issuance if you give us this stuff. I don't know how that's going. I've had one pilot recently who received a denial and he appealed, and then I got a whole laundry list of things that he had to get before they would consider him. It's problematic, and I don't know that they've worked it out. They're still working on it. There are other things that they have done, that the FAA has done that has helped. They have changed some of the regulations on colorblind testing. It used to be every time we saw a pilot, we'd have to test them for color blindness. Well, color blindness by and large is hereditary, and it's something that you're born with. Didn't make a lot of sense to have to do it every time we saw you, because once colorblind, always colorblind. And you have to get a SOTA uh, in order to qualify for that color blindness to fly, or have limitations or restrictions to daytime only and that kind of thing. But now what they do is we test you once. And so if you come in for a third class, we would test you. And if you pass, you never have to test again, unless you are going to upgrade your certificate to a first or second class. And then we have to test you once more. But once you pass that colorblind test, then we never have to test it again. You don't have to test again. So that kind of streamlines things and makes it better. So about 10% of the certificates that are applied end up being a special issuance. And you can see how many they issue. So they do push out a lot of special issuances and monitor pilots who have medical conditions. Um, they say that if you go through the process of special issuance, um, about 97% of pilots will be able to be issued, perhaps with some limitations. And so they try and get you into the air. Um, but sometimes the process is rather onerous, and can take a while. Um, so uh, they are dealing with a whole bunch of folks and try and do what they can to not make it any harder on them, because once again, they have limited resources too. One of the things that really slows down uh, the the process is if you get a DUI. And I had one poor guy who uh, worked real hard, got his CFI, uh, and went out to celebrate and then came in and saw me the next day. And he says, "Oh, yeah, last night I got a DUI." It was not pretty. It took a while. He had to go through the whole process of reporting his DUI, which of course you have to do. And he managed to do it. He said it cost him about $10,000, but he managed to keep his job. He kept his certificate, and he was able to continue. I had another fella who had a couple of DUIs in the remote past, and then got a DUI recently, and mentioned that. We sent in all this paperwork, and the FAA just said, "No, we're not going to do it." And so obviously this was the guy who after having a few DUIs, they just didn't want him to fly. And so they just denied him and said, "No, we're not going to do it." I don't know what finally happened to him. I don't know if he appealed and tried to do things, but pretty much they don't like it. So uh, certainly all of your students, you want to try and drive home 8 hours, bottle to throttle. You want to be sure uh, that they're not flying drunk, because that ends up being a real problem for safety in the national airspace, but also a problem for their passengers and everyone involved. So it's easier if you can't stop drinking, you probably should never fly. So that's kind of the thing that I try and make clear. So the things that we look at, is our job is to make sure that there's nothing that would hold back uh, a pilot from flying safely. We want to be sure that you're not going to have sudden incapacitation. But if you are healthy enough to fly, definitely we want to try and get you to fly. Um, AMEs are a broad spectrum of specialties in doctors, but most of us are family doctors, and we're acquainted with a lot of different medical conditions, and we can help you get through some of those things. We put on the examiner's hat when we see you, and I tell a lot of my patients, yeah, you qualify. Your blood pressure is, less than 155 over 95, and that qualifies for a medical exam. But if you were my private patient, I would treat you a lot more, and I would try and get your blood pressure in better control for your long-term health. But as far as being a pilot, you can go ahead and fly. There are always ways to improve the process, and we try to get the FAA to look at things, like looking at that color blindness test. But still, I can't get them to change that question 17B about the contact lenses. I don't know. Every time I see someone does that wrong in my passive aggressive way, I'll put in the form that, yeah, that's a confusing question and you should change it. So far, they haven't listened to me much. And so what we do is we are designees, just like CFIs are, and we don't work. We're not employees of the FAA, but we help the FAA certify pilots and get them in the air and keep them in the air flying safely. And that's kind of our job. And so, like you, our job is to have pilots who are safe and work well in the national airspace system to keep things safe. So that's pretty much all I have to say about being an AME. But you may have some questions about the basic med thing, and I don't do the basic med. The basic med is a process that was really set up for a pilot who has been certified before, has had at least a third class medical before, I think I don't know if it says it here, 2014. And then they do a 2 hour or yeah, 2 hour every 2 year course online, either through AOPA or through the Mayo Clinic, talking about safety in the air, and then go ahead and print out a form and take it to their private doctor, and their private doctor then certifies them. And they take that basic med and clip it in their logbook, and then they're okay to fly. Uh, some of the limitations on a basic med are here, and they've just recently changed some of those limitations as, in terms of the weights and things like that. But it's still, you're not allowed to kill any more than 5 passengers at a time. So there are some limitations. You can't go up into Class A airspace. Alpha doesn't want you up there. Um, but you can, with a basic med, you can fly at night, you can fly instrument and all that kind of stuff. Um, some of the conditions that aren't allowed, and you can see that these are things that might cause that sudden incapacitation. And so you have to go through the process, get deferred, get certified with a special issuance. And then after having a special issuance, then you can go on and get a basic med. Basic med was set up by Congress. And so it's a law rather than one of the FARs. And so really it's Part 61. I guess that's a FAR. But it was set up by Congress and kind of goes around the whole process of the FAA. So it keeps the FAA out of the whole thing. Um, and so you still have to have had at least a third class in order to qualify for basic med. And obviously, with a basic med, you're not allowed to fly for hire. Um, but you can instruct. You are able to take over. One of the things that the FAA is kind of arguing about, or one of the lawyers in the FAA, is that is a is a flight instructor taking a student for a ride as a passenger or as a flight instructor instructing. And I think they're still fighting about that. So I'm not sure where that has landed. Maybe the boot camp guys know better about that. But anyway, that's kind of where the FAA is. Um, and some of the problems with a basic med is you're not checking. So if you have a basic med, you could sneak by with a DUI. You could have complaints and it wouldn't mesh with the basic med, and we may not know about those things. Um, an airman could falsify their record they give to their family doctor, and that could allow them to fly with something they shouldn't be flying with. So there's some things uh, that the FAA has an issue with on that, but still saying basic med certainly has been very popular. And in fact, pilots aren't falling out of the sky who are flying on basic med. There aren't a huge number of pilots who who are having medical problems that are incapacitating them. But you can see that a lot of the folks who are applying for basic med are older, and maybe they don't want to come see me because they're concerned about some of their medical conditions. Uh, Wide range of people. You know, I didn't see that 101 year old pilot, but I have seen some pilots in their 90s. So uh, and maybe this is a reflection of just the proportion of pilots that there are. Many pilots are male, and you can see that the distribution of third class um, pilots who apply for a third class, as opposed to pilots who get the basic med, are usually your older pilot. And perhaps all those younger pilots are students and they're planning to move on and go on with a career in aviation. Um, so in 2020, there was a whole bunch of pilots with basic med, and you can see that a quarter of them had a special issuance. And so there are a lot of folks who have chose to go that way rather than submit all that paperwork for a special issuance. So again, I don't do the basic med. I think the basic med is best served by a doctor that knows the pilot. And I think the pilot, certainly everybody, I'm a family doctor and I think everybody should have a family doctor. Um, but I think that it is important for pilots to keep up on their health and keep up uh, on their prescriptions, keep up on their prescribed medicines. And even though their regular physician might say, oh, yeah, this is fine to fly with it, if you have a question, maybe get in touch with an AME and see if those medicines are good. Um, Again, the website has a whole list of things that would disqualify a pilot when flying. And but if the pilot wants to work with the AME and work with the FAA, a vast majority, 97%, can get a certificate and can fly legally. And that's a good thing. Sadly, we had a guy out here in Arizona. His girlfriend bought a tripacer. She wasn't a pilot. He had taken a couple flight or uh, instructional lessons, and he was flying this tripacer. He didn't have a pilot certificate or a medical. He may have been diabetic. And rather than doing things properly, he just flew, which you can, because if you don't get a ramp check, you can fly. And sadly, he killed he and his girlfriend. And so he probably didn't need to do that. He probably could have had adequate flight instruction, and he may have been a better pilot, and situation may have ended better. So anyway, I think that's pretty much what I have to say. Um, I'll stop sharing, I think, and go back to the guys at the boot camp, and we can maybe try and do some questions or something.
Okay, no problem. So there are questions in the chat, so I can go through some of those here quickly. So and there's also another AME in there too who's answering
Oh,
a lot of
great.
questions. Yeah,
Yeah,
he was
and
really good with a
by
lot of
no
things.
means I don't know everything. And you guys
Yeah,
did.
he commented.
Oh, good.
So let me find the some of the questions here. There's a lot of questions, but as you can imagine, now we can't take individual cases because just
Yeah,
not enough time for that. But
they'll have to take off their clothes if we do that. So,
yeah, exactly. There you go. Let's see the wings. Okay. All right. So this is Rich. His name is Sugden Sugden. He's been an AME for a long time, and he's answering a lot of questions as well. So
oh,
you can
great.
put them in the chat, hopefully, and save the chat if you want to, because we'll be able to come to that. So okay, let's move down the list here. Let's see. Okay, they found the guides. They're very talky. And the first DUI example provided, does the pilot now have to disclose that incident every time they go for a medical?
Every single time. And
Okay, we got
and
that.
so and I have patients I have pilots who have DUIs, have been through the process. A lot of times, if it's a serious DUI, they will end up with a HIMSS AME. That's a human intervention motivation uh, study. And those are AMEs who specialize in just that, either that or addiction problems. Pilots fly and they keep up with their hymns, but that's what they have to do. The pilots who have a minor DUI, and there are levels of DUI, some of those things I can deal with, and some of those things I have to send off to the FAA.
Okay, that was a question that came up. He was asking about that program. Another person was. So we kind of hit two birds with one stone on that one. Uh, does the FAA see what's been filed on your insurance? I don't think so.
I don't think so either. They do, of course, you sign that little thing at the bottom that says $250,000 or 6 months in jail if I falsify this. And then they say, and we're allowed to look at your driving record, and they do look at your driving record. And so if you have a lot of problems driving a car, they might consider you to have problems flying an airplane.
Okay, another person says those applicants who are receiving VA disability, what should I know that they're checking?
That's one of the things they ask, and what they want me to do is say, "What's your disability?" I can't tell you how many pilots get disability for tinnitus, ringing in their ears. They've been
Yeah.
around loud noises. Those guns are bad, and people get 10% disability for that. They say, "Oh yeah, I have 10% disability for tinnitus," and it's like, "Okay, good, off we go." You can hear me talk. We're ready to go. Uh, some of the folks who have things for PTSD, they may want the FAA may come back and say, "Tell me about that." And a lot of folks, when you muster out of the service, you sit down with a counselor and they say, "Well, you've been in combat, you've seen a lot of bad things. Do you ever have bad dreams about that?" And you say, "Well, yeah." And so they give you disability for PTSD, and these guys go on and have full careers as pilots, because they're trained flying Apaches and all this kind of stuff. Um, and then the FAA comes back and says, "Well, is this PTSD a problem with you flying?" And they have to answer the question, get some things worked up. And when they do, it then turns around and they say, "Okay, you're fine. See you later." And off they
Hmm,
go.
interesting. This is a good question. This does come up in we get this question a lot. I've heard the new regulations coming for things like antidepressants and ADHD and perhaps a few others, like other common issues that are problematic currently. So what is the waiting time for off ADHD medications?
So 90 days is what they want to see. I'm pretty sure that's what it is. And you need to be able to you need to be able to function. It's not good to be distracted on short final, and all of a sudden you're staring at the fuel gauge rather than looking at the flare. Um, so you have to be able to function. But having said that, a lot of pilots in their primary school days may have been put on some ADHD meds and then uh, gone off them in high school, done very well. And they said, "Oh, yeah, but back in grade school, I had some of those." I think folks who have trouble, they may want to review it. But pretty much, if you've been off meds for the last 90 days and you're functioning well and not having trouble, it's usually not a problem. As
And
far as
then,
the antidepressants, they finally changed it. You don't want to have a depressed pilot, that German kid in the who flew into the Alps. He probably should have been on antidepressants. And so they do have a few antidepressants. I think there are about five now that are okay. And there is kind of a flow chart in that guide that says, if you're on antidepressants, you can get off antidepressants. And if you do well and you have note from your therapist that things are going well, it's probably not a problem. Or if you've been on antidepressants or you're a career pilot and you're gonna be put on antidepressants, there are a few antidepressants you can use. You have to not fly for 6 months, and then you have to jump through some hoops, but then you have to prove that you stay on your antidepressants, which is not a bad thing. So it goes both ways, but it is doable, but it makes things a little more complex.
okay, that's interesting. So The other question that keeps coming up here is what lenses are approved after for cataract surgery?
Um, I've had cataract surgery, and they took me from 2040 down to 2015, which was like, yeah, so, but now I can't read because the cataracts took me down to 2015. So I have to wear glasses to read. So I wear bifocals, and that's okay. Uh, the toroid lens is one of the ones that's kind of special for astigmatism. Uh, they couldn't correct mine completely, so I also have some astigmatism. That helps. Um,
There's the
I'm not certain. I think there are some cataract lenses that you can read with and you can see
yeah,
distance with,
yeah,
and
that's
I'm
right. The
not sure
multifocal.
how that works. I'd have to research that to see how it goes.
Okay. So, yeah, I also had a cataract surgery. It was very interesting. I had a very good result from the toric lens for astigmatism. So it's really excellent. That's one of the best ones she says I've done for forever. And then I have a cataract in my left eye, but it's not, I don't need to do anything with it. So we tried to do, this was distance and this is a contact lens for up close. But my question there is if I have a glass, I take the contact lens out. I go get glasses like
Right,
that and then I can fly. I should
right.
be able to fly but the FAA doesn't like the other way around.
They don't like it the other way around. They think you
Yeah, but
might
it's
have
good
trouble
for me.
flying.
Huh?
Although, we know that when you flare, you're really looking out the side anyway.
Yeah.
It's difficult to look down the end of the runway. And so you're kind of looking there. So you can do it, but I think all this came from a PSA pilot who ran off the end of the runway. Uh, I think at Reagan. But anyway, he ran off the end of the runway and they said, "Oh, you ran off the end of the runway. Bad deal." And he says, "Oh no, I had these contact lenses in asymmetric contact lenses." And they said, "Okay, no one else does that." Well, they looked into that pilot's record and they found that he did some other things that weren't so good. So maybe he's
Hmm.
just a crappy pilot.
Okay. One good question is my AMA deferred me to FAA. How do I know if the FAA received the paperwork?
So 60 days. If not, you can write them. And also, a lot of times they'll come back with a laundry list, 60 days and say, you have 60 days to give us this. And get another cardiac catheterization or all kinds of stuff. Um, and that's hard to put together. So if you're having trouble putting it together, write them. I just had a guy last week who wrote them and said, "Hey, I need more time." They'll give you more time. They'll try if they can. Of course, they sometimes will write back and say, "It's going to take us a little longer. We need another 6 weeks to process this."
Hmm.
And uh, and they don't always give you 6 weeks, but that's the way it is.
All right. That's a good question. If you have a vertigo incident diagnosed as BPPV,
Yeah.
can an AME issue or is it deferred or denied?
If it's a solitary incident, uh, it's probably not a problem. If it happens frequently, you could see it might be a problem.
Yeah.
Uh, there's also global amnesia, which is kind of a weird thing where suddenly you have loss of memory and you're out, but it's a solitary incident. And if you get worked up, and if that's all it is, you can fly. I had a pilot issue with that.
Huh, that's good. The other one, we're getting close to the end, but
Yeah.
I said they're curious to hear about the experience you've had with any of the 2024 changes to mental health policy.
Just one, they're reviewing a lot of the PTSD things. They have pretty much codified the way to get in with depression and antidepressants, and that's good. They've also changed some of the rules, and again, that's in the guide on ADHD. Um, but clearly, there are some people who are psychotic who probably shouldn't be flying. Uh, you know, bipolar. I think if you have a bipolar diagnosis, that pretty much sinks you. I just don't know a way to get flying again.
Hmm. So then, some last questions would be, so my advice, what I tell our students is don't go fill out the basic med application and go try to sit for a medical until you've had some consultation to say, because I may not, I'm not your best. I don't know what maybe some things I would know, but other things that I may not know. And if you get deferred, it could take a while. So, or maybe you won't get it. So there might be other avenues for you. So I don't know. I guess if someone were to call you and say, I would like to do that, is that something most AMEs you would think would be receptive to?
Yeah, and I'm kind of a pushover. I will talk to anybody anytime. Uh, but it is not unreasonable to schedule a visit with an AME, a consult, and I still have pilots that do that. I had one 2 weeks ago who said, I want to schedule a visit. I have these eye things going on, and I'd like to get in and just talk to you about it. My medical's coming up in 3 or 4 months, and I want to know, is there something else I can do? And I was happy to talk to him. So I think most AMEs would be happy to schedule a visit with you and do that.
Okay, well that's good to know because I think that's the best advice I could possibly say is don't just recommend that people go out and get medicals. Just make sure that things are good before you go, right?
You
And that's good.
listed
Well,
a website of a guy there in Florida, an AME in Florida, and I looked at his website. I can't remember. This was a few weeks ago, and I looked at his website, and he was a wealth of information, had a lot of good stuff. So
oh,
maybe look back at your stuff, and his website was very good.
okay, that's quite good. Well, I want to thank you very much for showing up today. It was incredibly good. So you did a really bang up, smash up job. We really
Good.
appreciate that. We're going to close out, but if you're able to stay around, you can and answer questions. I know you're kind of busy, you have things to do, but if you want to, you can. Otherwise, I just want to extend my thanks and say to the rest of the crowd, we'll see you next Saturday. We're going to talk about adding. Live from CFI Boot Camp in Miami Beach, Florida. This is the Power Hour. Welcome.